Hello, welcome to Caldwell County Today. My name is Paige Counts, Public Information Officer for Caldwell County. Today joining me is Roger Haley with RHA. Welcome, Roger.
Thank you. Good to be here.
Roger, I'm going to start with what I hope is an easy question for you. What is RHA?
RHA began in 1989 as a support service. And of course it has expanded more recently, and we provide disability services. Folks who have disabilities have a good access to many services, and then behavioral health services, of course dealing with mental health, and then substance use services. And we have both in-house and outpatient services. The mission for RHA is to provide a safe and healthy environment while creating opportunities. And the shared mission would be setting the pace for excellence in supporting people, and shared value and vision is the organization's fundamental reason for existence.
And you alluded to this in your answer, but who do you serve?
We serve all the public in Caldwell County. Of course, our main office here in this state is in Asheville, and there are offices in several counties throughout the state.
Okay. And you mentioned disability services. What does that entail?
That is folks who were born with some disabilities, or may have disabilities due to accidents or something along those lines. People who have been born with handicaps. Mm-hmm. We are provide services for those people.
Oh, and can you give me an example of what those services are?
Well, there's the in-house services where people stay in RHA's places of care, mm-hmm. And then they also help them work into jobs and put them into the labor force, and medical services for those with disabilities.
And I think one of the other things you mentioned was substance abuse services. Tell me a little bit more about that. Yes,
we deal with people who have drug problems or alcohol problems. Again, there is an in-house service where people can come to dry out, find help and support, to help with their substance abuse mm-hmm. problems. And then, of course, we also do community work, prevention, where we go into stores and provide information about tobacco sales, alcohol sales, and provide the law concerning tobacco sales, and trying to help people know that people under 21 mm-hmm. are not to be using tobacco or
right.
alcohol. We do those type of things, and also we go into the schools and provide some education there for young people.
And the third thing you mentioned, and I realized I didn't do these in any order, I'm just kind of winging it here, was behavioral health services. Can you explain that a little bit?
Behavioral health is, of course, dealing with folks who have mental health problems, and helping people have a more normal life, helping them deal with their anxieties, fears, depression, those type of things. Of course, there is an in-house service for that. And then, the community services We provide therapists, psychologists, and folks who can help people have a better mental health, you know, and encourage people to come out and to find the help that is needed during this time.
Mm-hmm. If somebody needed to get a hold of RHA, how would they do that?
Well, the local number would be 828-394-5563. That's for the Caldwell office, and they can call there. And then, you know, if they need the services for disability or for substance abuse, they would be referred probably to Asheville. Mm-hmm. But call the local number and they will direct you to the right place.
Good. And you are also working with the North Carolina Department of Health and Human Services for a program called Hope for NC. Can you tell me a little bit about that program?
That's right. Hope for NC is actually a FEMA project, mm-hmm. But it also comes under Hope for NC, which is the state version of FEMA, is what I call mm-hmm. it. And it came about because of COVID. But Hope for NC actually started back with the last hurricane that came here in North Carolina. And then it continued because of COVID. Mm-hmm. So, you know, we know that during this time, there's a lot of stress surrounding mm-hmm. COVID and those who are facing problems with COVID. And so, you know, we know it can be very overwhelming at times. Folks are not able to visit their families in the hospitals. Mm-hmm. You know, they're facing the fear of death and, you know, facing just the fear of getting COVID. Mm-hmm. And so it can be very overwhelming. And so this crisis counseling program that comes through Hope for NC provides a time of support for that. But the crisis counseling doesn't have to relate to COVID in order for people to receive it. It can relate to any anxiety or depression that people may be facing. And you know, we are just here to provide support during this time.
And it's a two-part service. Tell me about the two parts to this service.
It is the helpline, mm-hmm. of course, and people can call the helpline 24 hours a day. The number would be 855-587-3463. That's not a number that's easy to remember, but we have tried to place you know, information about that throughout the community. And then, of course, the second part is the crisis counseling program. And people call the helpline, and they are directed to us in Asheville. We get a call list every day, and then we connect with those people who call in on the helpline. Also, I might say the helpline provides some other resources as well. There's help for housing, help for utilities, and some other programs that are available through the state.
And you named some of this, but with the crisis counseling arm, what are some of the support for individuals specifically?
Well, we, of course, provide confidential, personal service that, you know, people can come and talk to us without fear of sharing it with anyone else. We can do counseling by going into the homes, at least until COVID gets mm-hmm. worse. We can do virtual counseling and we can do multiple follow-ups. This is short-term counseling, and so, if it gets into something that we can't handle, we refer to RHA or to other providers of mental health support.
But this is a good first step for people.
It is. That's what it's designed for. It's just a first step, and once we are able to make contact, we do meet with those folks on a first-time basis, and then we evaluate whether they should go farther with us or whether we should refer them to someone else. And usually our counseling is only 4 or 5 sessions, and then we refer to someone else or hopefully provide the help they need.
Right. And you also offer some service to other healthcare providers, organizations, community groups. Can you tell me a little bit about what you do for that population?
We go in and make referrals, to other organizations, but we also can go into schools and do little sessions, educational sessions, in order to make people more aware of what mental health is and what we're doing with mental health. We can meet with small groups in churches or different community organizations, provide education for them concerning this program and other programs that are available in the community. We can do outreach networking. Also, I have done a little what I call talk it up sessions, and meet with folks in small groups and just talk about how COVID has affected them and let people share their frustrations and maybe anger about this time, and just talk with others. It's non-political, but it's just a time of support for each other. Actually, the members support each other during that time.
In your Talk It Up sessions, if you could preview that just a little bit, and I know this is a surprise question, so what are some of the things you cover? If you just did broad strokes, what does that look like?
Well, I just asked them how COVID has affected them, has it touched their lives? There may be those who share their sorrows during that time. And then, we talk about how we as a group, those that we gather with, can support those who are facing COVID. Then there's a time to talk about your frustrations and anger during this time. Why can't you visit the hospitals like you used to, or the nursing homes? It's just a time to get things kind of off your mind a little bit during this time.
Certainly. And we've talked about a lot of things, and I don't know if we've covered everything on the Hope for NC.
Okay, there's also on Hope for NC, there is also a helpline for healers. And this is designed especially for people that are in health services, emergency service workers, and professionals in the medical service. And they can call in to a number. Let me give you that number. That's 919-226-2002. And that is Hope for Healers helpline. We provide support from the stress that people are facing, and try to be of encouragement to them. Another thing that I think we should mention concerning Hope for NC is that it is free to everyone. There's no charge for any of this. You don't have to have insurance or any form of payment. It's free, and there is very little paperwork with it. Actually, the counselor does all the paperwork, and the people calling in don't have to go through any red tape or paperwork that's needed in other instances. And
it's free to everyone.
It is free to all the community. No income basis, no ethnic basis, just to everyone across the board.
And Roger, we've talked a lot about mental health. What do you say to an individual to overcome that stigma of seeking mental health treatment?
Well, I would say, first of all, don't be afraid to express what you're feeling, what you're going through. Sometimes there's a fear of telling people how you really feel or where you're at in life, the stress that you're under. Don't fear that, and you need to reach out to someone who can help you. Actually, we have a little thing called the Scoop, and that is help for managing stress. First of all, stay connected to your family. We know that during this time of COVID that sometimes, we're isolated from family members, but make phone calls, try to find some way to stay connected with friends and family. The second thing we would say is you need compassion during this time. Compassion for yourself and for others. The Bible actually says, love your neighbor as yourself. So that's not saying that we should not love ourselves. And sometimes we need self-love. So be compassionate toward yourself as well as to others. And then observe the use of substance. We know that sometimes people during this time tend to use too much alcohol or to seek for illegal drugs or something along those lines. But observe the use of substance and know that early prevention in having problems with substance abuse is very important, that you seek for early intervention before it gets out of hand. Then also know that, again, it is okay to ask for help. Struggling is normal during this time. We all struggle. I've talked to many professionals who are struggling, with how to handle church or how to know what to do with their businesses. People are just struggling during this time. But ask for help, and help is empowering. And then last of all, physical activity is important. It's still good to be able to get out and do some outside activities, get plenty of exercise. And we know that exercise, can boost your mood and can lower anxiety as well.
Thank you, Roger. Is there anything else that we need to cover? I should ask that before we wrap up.
I think that's about it. I certainly appreciate your time and being able to present today. And we hope that people will seek help and know that help is available, and hope is available during this time.
All right. Well, thank you for being here. And thank you for watching Caldwell County Today.